Abe Oudshoorn can moo moo, buzz buzz, pop pop, eek eek, hoo hoo, clop clop, dibble dibble, dop dop, and apparently even cock-a-doodle doo. What that means, I'm not sure, but I think he's got something good to say. Here is Abe Oudshoorn.
That goes out to all the parents in the crowd. Stupid healthcare system, stupid drug costs, and stupid doctors that take care of their families before they take care of me. And stupid cancer rates are going up, and we're not doing anything about it but spending more money, paying more taxes, and we just can't keep up. It's going to overwhelm us. This is ridiculous. Our healthcare system is out of whack. It's ridiculous, and we need to change it. Canadians are angry. We're mad about paying so much taxes for so little care. Why do we pay for a terrible healthcare system? Well, that's what I hear a lot of as a nurse. But I can tell you, we actually have one of the best healthcare systems in the world. And that's not just because I'm being patriotic Canadian. The statistics show this, and I want to show this to you too. Let's think about our life expectancy. We are tied for the 8th best life expectancy in the world. And we actually beat 7 countries that have a higher GDP per capita than us in terms of our life expectancy. So it's not just about money and the resources that we have, but it's about our system. And how are we spending that money? Are we getting bang for our buck? Well, here's a chart for you that's life expectancy on the y-axis and what we're spending on the x, and we're actually getting good bang for our buck. Look at the poor US way over there spending all kinds of money but not having good outcomes in terms of their health. We're right in the middle. And we have better drug costs. We pay less. For some reason, our sexual performance drugs we're getting ripped off on. But the rest of it, we're actually doing better. We're not paying more for our drugs. And when we look at our poor neighbors to the south, we're paying less for administrative costs because of the insurance system that they have, and we're spending less of our own personal money for our health care. Less of us avoid health care because of the cost, and we're spending half as much on litigation that they do in the US. So something's working for us, and we're also taking care of ourselves better. Our smoking rates are only 57th in the world, which looks pretty bad, but when you actually looked at the developed nations, we're 3rd only behind Norway and Brazil, so we're taking care of ourselves. But what about wait times? Because everyone's pissed off about wait times. 8 months for heart surgery, 4 months for an MRI. I'll tell you though, when you look at the wait times, there's a difference between what we really need and what we need at some point. Because this is the wait time for emergent care. The y-axis there in time is seconds. When you need a CT because you might be dying, you can get one in 10 seconds. Because there's a difference between what we know we absolutely need to do right now and what you can get at a later time. You know what we do? We even send people. If we can't help you with what you need, OHIP will pay for you to go to another province, even to go to the States to get that care that you need. So all this rumor about leaving people to die is a lot of rumor. Except the emergency rooms. Emergency rooms are pretty crowded and there is a long wait for emergency care. But that has a lot to do with our mental health care system as well and the struggles we've had with that. And the fact that people are going in crisis to the emergency room, which is not the best place for people to get good mental health care. But we're doing something about it. We're looking and we're rejigging and we're revising the system. The province brought in the LHINs to help us better organize ourselves. What did people do? We complain about the cost of the LHINs. But the LHINs is actually reorganizing our mental health care so that people can get the care they need when and where they want it. What we're doing is we're moving care out of London back to people's home communities. Here's our LHIN here. So in the future, when someone gets sick with a mental illness in Owen Sound, they won't have to come to London to get their care. But yet all we do is we protest the lost beds, and we don't realize these beds are going back to more appropriate places for people. And the spending thing, when you look at the graphs of it, everyone's saying, all this health spending is going to cut into our education, it's going to cut into our child services. When you look at the stats, that's not happening. Those are plateaued while healthcare is growing, but it's other government services that are getting cut. Why is that going up? The healthcare is going up because we are getting older, and we can't prevent that. We know that our healthcare will be more expensive. We're working to make it more efficient, but it will be more expensive, so we will have to pay more if we want what we have. Instead, we can, be Peru. They hardly pay any taxes, but we lose 15 years off of our life expectancy. Is that what you want? And so we have values as Canadians. We can get the government out of our pocket, but we can lose our healthcare system. I'm a happy taxpayer. I admit it. What's your values, and what are you willing to pay for them? Thank you.